St. John's wort is also known as Hypericum perforatum. It's a flowering plant of the genus Hypericum, and it's been used as a medicinal herb for its antidepressant and anti-inflammatory properties for over 2,000 years. The Greek physicians of the 1st century recommended the use of St. John's wort for its medicinal value, and the ancients believed that the plant had mystical and protective qualities. St. John's wort uses date back to ancient Greeks, include the treatment for illnesses such as various nervous and mood disorders. The name was given to the plant because it blooms around June the 24th, the birthday of John the Baptist, and the word wort is an English word for plant. St. John's wort is most commonly used as a natural remedy for depression and other common issues like anxiety, tiredness, loss of appetite, and trouble sleeping. It's also used to treat heart palpitations, moodiness, and symptoms of ADHD, obsessive-compulsive disorder, seasonal affective disorder, and the menopause. The St. John's wort plant is native to Europe, but is commonly found in the United States and Canada, in the dry ground and roadside, meadows and woods. Although not native to Australia and long considered a weed, St. John's wort is now grown there as a crop, and today Australia produces 20% of the world's supply. Pharmaceutical companies, particularly in Europe, prepare standard formulas of the herb that are taken by millions of people. Today, worldwide, annual sales of products made from St. John's wort exceed several $billion. St. John's wort produces dozens of biologically active substances, but two compounds found in the plant, hypericin and hyperforin, have the greatest medical activity. Other compounds include flavonoids like rutin, quercetin, and kaempferol, and also shikimic acid. Many studies show that St. John's wort may help to fight mild to moderate depression and anxiety, and it has fewer side effects than most other prescription antidepressants, such as loss of sex drive. However, there are St. John's wort drug interactions, so the herb should be taken only under the guidance of a healthcare professional, especially if you already take medication for depression. In a 2017 meta-analysis, including 27 clinical trials and over 3,800 patients, researchers concluded that St. John's wort has comparable efficacy and safety to SSRIs. Studies show that St. John's wort use seems to work as well as selective serotonin reuptake inhibitors, which are a popular type of antidepressants that doctors often prescribe to first treat depression, such as Prozac, Celexa, and Zoloft. Researchers aren't exactly sure how St. John's wort works for depression. Some have suggested that the herb acts similar to an SSRI because it makes more serotonin, dopamine, and norepinephrine available in the brain. These neurotransmitters help to improve your mood and can be responsible for treating symptoms of depression. In studies using the rat forced swimming test, which is an animal model of depression, St. John's wort extracts induced a significant reduction of immobility. In other experimental models of depression, including acute and chronic forms of escape deficit induced by stressors, St. John's wort extract was shown to protect rats from the consequences of unavoidable stresses. St. John's wort use also includes improving mood in people with seasonal affective disorder. It's a type of depression that occurs during the winter months because of the lack of sunlight. Seasonal affective disorder is usually treated with light therapy, and there's some evidence that using St. John's wort together with the phototherapy works even better as a way to beat the winter blues. Because of its positive effects on mood, St. John's wort has been used to alleviate and naturally remedy PMS symptoms such as depression, chronic fatigue, and hormonal imbalances. A study that was done at the Institute of Psychological Sciences in the United Kingdom included 36 women who were aged 18 to 45. They had regular menstrual cycles and were diagnosed with mild PMS. The women were randomly assigned to receive either St. John's wort tablets at 900 milligrams per day or an identical placebo tablet for 2 menstrual cycles. Then the groups were switched and this was repeated. Symptoms were rated daily throughout the trial using the daily symptom report, and the women reported feeling of depression, aggression, hormonal balance, and hormonal stimulation. The trial showed that St. John's wort is superior to a placebo in improving physical and behavioural symptoms of PMS, but there were no significant effects compared with a placebo in treating mood and pain-related PMS symptoms. The researchers reported that daily treatment with St. John's wort was more effective than a placebo treatment for the most common physical and behavioural symptoms that were associated with PMS. St. John's wort use includes being tested as a herbal remedy that relieves the psychological and vegetative symptoms of the menopause. A study published in Advance in Therapy and performed in Berlin investigated 12 weeks of treatment with St. John's wort. 111 women aged 43 to 65 took one 900 milligram tablet 3 times daily. All of the participants experienced symptoms characteristic of the pre- and post-menopausal state. The treatment outcome was evaluated by the Menopause Rating Scale, a self-designed questionnaire for assessing sexuality, and the Clinical Global Impression Scale. To test the results, the incidence and severity of typical psychological, psychosomatic, and vasomotor symptoms were recorded after 5, 8, and 12 weeks of treatment. A substantial improvement in psychological and psychosomatic symptoms were observed, and menopausal complaints diminished or disappeared completely in 76% of the women. In addition to this, sexual well-being also improved after treatment, displaying that St. John's wort use include providing natural menopause relief. St. John's wort has antibacterial properties, and it may also help fight inflammation, that's the root cause of most diseases. When applied topically, it relieves symptoms that are associated with minor wounds and skin irritations, working as a natural treatment for eczema, a home remedy for burn relief, and a way to naturally treat hemorrhoids. St. John's wort shows anti-inflammatory properties due to its inhibitory effect on pro-inflammatory genes like cyclooxygenase 2, interleukin 6, and inducible nitric oxide synthase. These genes play a critical role in chronic inflammatory diseases. St. John's wort extracts have been used for thousands of years to treat cuts and abrasions. Its usefulness in reducing inflammation is well known, and it appears to be related to its ability to serve as an antibacterial agent. In a 2003 study at the Department of Dermatology at the Freiburg University Clinic in Germany, 18 patients with eczema were treated twice daily over a period of 4 weeks. After the trial, the severity of the skin lesions improved on the site of treatment, and skin tolerance and cosmetic acceptability was good or excellent with the St. John's wort cream. And in 2017, a case study showed St. John's wort extract provided significant efficacy for the treatment of pressure sore wounds in an intensive care unit. Obsessive-compulsive disorder is a mental health disorder where people perform certain routines repeatedly and are unable to control their thoughts or activities. This can be a debilitating condition, so the data that suggests the positive effects of St. John's wort is indeed promising. A study that was done at the Dean Foundation for Health Research and Education analysed 12 patients who were diagnosed with OCD. The participants were treated for 12 weeks with a fixed dose of 450 milligrams of a 0.3% St. John's wort twice daily. The study included weekly evaluations that were conducted with the Yale-Brown Obsessive-Compulsive Scale, the Patient Global Impressions of Improvement Scale, and the Clinical Global Impressions of Improvement Scale, and a monthly evaluation with the Hamilton Rating Scale for depression. Significant changes occurred within 1 week, and they continued to increase throughout the trial. At the endpoint, 5 of the 12 patients were rated much or very much improved on the clinician-rated CGI scale. 6 were minimally improved, and 1 had no change. The most common side effect reported was diarrhea and restless sleep. Because improvements began at 1 week and grew over time, researchers believe that St. John's wort can be a helpful tool in treating OCD, and more placebo-controlled studies should therefore take place. Researchers have found that St. John's wort stops the growth of tumour cells, and it can treat both non-melanoma and melanoma skin cancer cells. Because St. John's wort has shown to have significant anti-tumour activity, researchers also suggest that it's an effective cancer-fighting treatment that's available in abundance because it's a naturally occurring plant. Data from a 2003 study done in Spain indicates that hyperforin, which is a derivative found in St. John's wort, is a compound that interferes with key events in angiogenesis, which is the formation and the growth of cells. This confirms the recent and growing evidence about a potential role of this compound in cancer and metastases inhibition, and makes it a promising drug for further evaluation in the treatment of angiogenesis-related pathologies. A systematic review conducted in Canada found that St. John's wort may promote smoking cessation by alleviating tobacco withdrawal symptoms and decreasing negative effects through various mechanisms. Research suggests that the herb is able to inhibit monoamine oxidase A and B, and it's involved in dopamine and noradrenaline reuptake. These actions help to reduce symptoms which are associated with stopping smoking. St. John's wort can be obtained from a local health food store in many forms in many countries. It can be found in capsules, tablets, tinctures, tea, and oil-based skin lotions. You can also find St. John's wort in chopped or powdered forms. Most products are standardized to contain 0.3% Hypericum. Make sure to read the label before making your purchase. Most studies on St. John's wort have been conducted in adults, but one study involving more than 100 children under the age of 12 indicated that St. John's wort may be a safe and effective way of treating mild to moderate depression symptoms in children. If you're thinking about giving your child St. John's wort for depression, you should also consult a medical supervisor first. Children being treated with St. John's wort should be carefully monitored for allergic reactions or side effects like diarrhea or stomach upset. For adults, the typical dose in capsule form is about 300 milligrams taken 3 times daily with a meal. You should consult a healthcare professional before taking more than the standard dose of St. John's wort. To improve a specific condition, you may benefit from following some of these recommended doses. For anxiety, 300 milligrams of St. John's wort taken by mouth 3 times per day. For mild to moderate depression, 300 milligrams 3 times per day. For severe depression, 900 milligrams of St. John's wort for 8 to 12 weeks with a doctor's approval. For psoriasis, the use of St. John's wort ointment 2 times daily on the skin for 4 weeks. For wound healing, a 20% St. John's wort in petroleum jelly on affected skin 3 times daily for 2 weeks. For menopause symptoms, 300 milligrams once daily for 12 weeks. For PMS, 300 to 900 milligrams of St. John's wort by mouth daily for 2 menstrual cycles. For irritable bowel syndrome, 400 milligrams twice daily for 12 weeks. For nerve pain, 300 to 900 milligrams in tablet by mouth for 2 treatment periods of 5 weeks each. For obsessive compulsive disorder, 450 to 900 milligrams by mouth daily for 12 weeks. If you're taking a dose above 300 milligrams 3 times per day, you should consult a healthcare professional first, and it's best to reduce your dose slowly over time instead of stopping St. John's wort suddenly. Extensive research supports that St. John's wort use is safe when taken by mouth for up to 3 months, and some evidence suggests it can be used safely for over 1 year. St. John's wort side effects include trouble sleeping, vivid dreams, restlessness, anxiety, irritability, stomach upset, fatigue, dry mouth, dizziness, headaches, skin rash, diarrhea, and tingling. Keep in mind it generally takes weeks or even months for St. John's wort's benefits to become noticeable. It's not a fast-acting treatment for conditions like depression, and increasing your dose isn't going to make it work immediately. You need to give it time. When taken in large doses, St. John's wort may cause severe reactions to sun exposure, so be sure to wear sunblock outside, especially if you're light-skinned. Taking St. John's wort is not recommended for women who are pregnant or breastfeeding. It's most likely safe for children between the ages of 6 and 17, but they shouldn't take it for more than 8 weeks. There's a number of health cautions pertaining to St. John's wort use that need to be considered before taking. Recent research shows these interactions result from the ability of St. John's wort components to produce intestinal or hepatic enzymes that either remove drugs from the body or metabolize them into inactive forms. Some cases have found that it can interfere with conceiving a child, worsen the symptoms of ADHD. When taking medication already, it can lead to manic episodes in people who are bipolar or who suffer from major depression. It could contribute to dementia in people with Alzheimer's disease, or it could bring on psychosis in some people with schizophrenia. If you're taking St. John's wort, be mindful if you notice an allergic reaction, feeling of fatigue or restlessness, increased blood pressure, increased sensitivity to the sun, or an upset stomach. It's important to tell your doctor if you're taking St. John's wort because it does interact with several medications, including birth control pills, allergy medicine, sedatives, medications for migraines, and heart disease medications. You should also consult a doctor before taking St. John's wort if you have a bleeding disorder, if you're suicidal or severely depressed, have a weak immune system, take drugs for HIV or AIDS, have high cholesterol, have seizures, have a weak nervous system, if you're prone to swelling, have stomach or intestinal problems, have cataracts or have diabetes.